All right, good afternoon. We are going to demonstrate how to attach pacing wires, epicardial pacing wires, to our pacing cables and our temporary pacemaker. In the CCCU, we use the Medtronic. You should have in the medroom a box that will contain a pacemaker and both atrial and ventricular cables. Patients that come out of the OR are always given temporary wires. They can be atrial and ventricular, or just ventricular, and each set will have one wire and one ground. When we connect the wires, we're going to take the wires on the right side, which will be atrial, and grab the atrial cable. On the cables, they are color-coded in two different areas. So blue is atrial, and then the cable itself will be blue. And they also have a picture of the heart on this particular cable. So when you take the wires, you will take the caps off the ends, and you will insert each wire into either hole. So it doesn't matter which one it goes into, plus or minus. You're just going to put them in, and then you will tighten each side so that they're locked into place. Then you will take the bottom of your cable and you will plug it into the corresponding spot on the top of your pacemaker, again color-coded with an A, so A for atrial. Now we'll do the same for the ventricular wire. So same idea, there'll be two wires, a ground in either of the slots. You're going to tighten over top of the wire, and you are going to match up your white or ventricular with the corresponding spot on your pacemaker. So you are now plugged in both atrial and ventricular. Now we're going to go over the settings. So as you can see, this pacemaker is set to pace both atrium and ventricle. So at the top you have an A with a green flashing light and a V with a green flashing light. That's telling us that the pacemaker is pacing both atrium and ventricle. If that flashing light was yellow, that means the patient is being currently sensed. The next setting you have is the rate. So we are currently set at a rate of 130. And then we have atrial and ventricular output, and those are both set at 10. At the bottom of the screen, it tells you what setting you are on. So you are currently set to pace at DDD. The next box is the life of your battery, which is important for your safety checks. And the next box is how to unlock the bottom menu. We'll demonstrate unlocking that bottom menu to get the other settings that are required for your documentation. So you're going to press the key, and then you will see the bottom menu is there. You have your atrial sensitivity, your ventricular sensitivity, your AV interval, your upper rate, and that is all that's required for your documentation. Now we're going to demonstrate how to change a battery. It requires two AA batteries. You're going to pop that button, open the receptacle, pop out your two old batteries, and then pop in your two new batteries. And then close and secure the compartment. You do have a 15-second timeline to change your battery. There we go. For documentation purposes, you need to go under the CCCU flow sheet for the pacemaker settings, and then under lines to do your assessment of the wires themselves.